My name is Hallie Gonzalez, and for my presentation, I decided to do it on Salmonella, which is a foodborne disease. This problem exists because in our society, the most common and convenient way of food production is to produce it in mass quantities. Some examples of food that are produced in mass quantities are tomatoes and lettuce. Since the Salmonella bacteria is most commonly found in the gut of animals, they can contaminate water with their feces. When this contaminated water is used for irrigation, it spreads to the produce. The outbreak of Salmonella dates back to centuries ago. For instance, Alexander the Great, Prince Albert, and many during the Spanish War were infected and died from Salmonella. However, the bacteria wasn't named and identified until 1885 by Dr. Daniel Salmon and his research assistant. Some risks for the community in the future may include contamination of food, water, animals carrying the disease, or any exposure to feces. If someone is contaminated by this bacteria, the symptoms may include diarrhea, fever, abdominal pain, or nausea and vomiting. Some of the etiological factors or sources of Salmonella in food may include eggs, poultry or meat, unpasteurized milk or juice, cheese, fruits, vegetables, spices, or nuts. In regard to the environment, some etiological factors may include snakes, reptiles, amphibians, bird, pet food, or water. In regard to the processing and manufacturing industries, some sources of contamination may include dirt, soil, dirty packaging, or a worker's hands and clothing. Some public health strategies may include educating the public on preventative measures, such as cooking the meat thoroughly until the juices run out clear, washing hands, rinsing fruits and vegetables before eating, and maintaining a clean environment. Another strategy may include regulations such as the Hazard Analysis and Critical Control Point, which creates procedures for testing ingredients for chemical residues, cooking products to kill bacteria, and refrigerating pre-cooked food to keep new bacteria from multiplying. Eliminating the reservoir or the animals containing Salmonella may be another strategy for intervention. In the past, doctors have used antibiotics to eliminate bacteria within a patient. This is an example of tertiary prevention. Manufacturing industries have also started pasteurizing their products, which is an example of primary prevention. The issue of the Salmonella bacteria infecting food products can be prevented at different levels. It is important to have multiple policies and systems of prevention to avoid contamination. Using M.J. Nada, A.W. Van de Giezen, and A.M. Henkins' research on intervention strategies, one possible mode of prevention of the Salmonella bacteria may include testing animals for infection and separating the contaminated animals from the non-contaminated animals, which would inhibit further spread of the bacteria during breeding and slaughtering processes. Another possible prevention method would be following the procedures of the HACCP, which would include testing ingredients for chemical residues, cooking products to kill bacteria, and refrigerating pre-cooked food to keep new bacteria from multiplying. These procedures would help prevent the spread of Salmonella at the manufacturing level. In my opinion, I believe that preventative action should be taken at multiple levels of food production and processing. Separating contaminated food from non-contaminated animals is a good way to control further spread early on. As the researchers' data suggests, it decreases the amount of contaminated animals being sent for processing. I also believe that following the HACCP procedures would decrease contaminated food products. If, however, these procedures failed, it is important that people cook foods properly and maintain a clean environment around food.